So let's talk a little bit about the who's who. I'm going to turn it over to Dr. Eskew. I thought this would be a great place for us to start because a lot of times at Frame, we have people asking, well, who do I go to for, talking about my periods? Or I've heard this term RE or REI. What does that really mean? So thought we could at least start with some of the names, some of the acronyms, and just give you a lay of the land of who you might encounter on your fertility journey. So I'm going to let Dr. Eskew walk through this.
Yeah, so I think that this is definitely an important topic to cover. So I'm glad that we added it to this. So, kind of starting with who you see on a, typical annual basis really tends to fall into one of two categories. And this is for men, could be either your primary care provider, that could be someone who's family medicine trained. It could be a mid-level provider like an NP or a PA, a nurse practitioner, a physician assistant. It could be an internal medicine provider or an IM doctor. So lots of like alphabet soup there with the different kind of credentials, but they kind of do screening for overall health and wellness in general for both men and women. Now, some primary care providers will also do more of the preventative female care, if you will. So your routine pap smears, they'll order your mammogram for you, that sort of thing. And I think that that's a great place to get started to get overall general care and wellness, especially if it's not necessarily on your radar yet in terms of family building, but just want to keep up with your preventative care. And then you have obstetrician and gynecologist, so or an OBGYN, who also functions as a primary care provider for a lot of women, because a lot of times this is the only physician that women will see and get care from. So they can do a lot of preventative care, same thing, the pap smears, that sort of stuff. They also do more surgeries. So if you have issues with fibroids, which are really common, endometrial polyps, one of the things that was on Dr. Mumbai's bio was, adenomyosis and that sort of thing. They will also often start the workup for infertility as well. So if you're well established with an OBGYN provider and you say, hey, I'm either starting to think about trying to conceive, it is good to tell them that. They're going to order specific labs, preconception testing. They'll do some extra education on, lifestyle factors, make sure you're on a good prenatal vitamin, offer carrier screening, more of the preconception type counseling that's really important prior to pregnancy. So telling them that number one, you're thinking about trying in the near future, and also when you get to the point when you've been trying for some time, and that could be 6 months for women above the age of 35 or 12 months if you're less than 35, that would be consistent with infertility. And oftentimes they will start that workup by getting baseline evaluation for both the female partner and the male partner. And depending on the cause, can often initiate treatment. So it's not uncommon to have an OBGYN do medications to help a woman ovulate if she has issues with ovulatory dysfunction, which is often the case with women with polycystic ovary syndrome, for example, which impacts 1 in 10 women. Some OBGYN providers will also do, kind of the initial treatments for fertility treatment for mild male factor, including intrauterine inseminations and that sort of thing. But beyond that, that's whenever you kind of step into the scope of the RE or the REI. And that's the REI stands for reproductive endocrinologist and infertility specialist. And I think it's also important to kind of go over the differences in training and providers as well, which we'll kind of talk about with maternal fetal medicine, MFM, urology as well. So for OBGYNs, general OBGYNs, they do 4 years of medical school and 4 years of residency. And they do, as an OBGYN resident, we train in all sorts of area, labor and delivery, GYN oncology, urogynecology, reproductive endocrinology. So a lot of different areas. And then ultimately you have OBGYNs that sometimes just do GYN, so just gynecologic care, and some that just deliver babies or just obstetric care. But it's 4 years of residency and passing 2 sets of boards. And then if you decide to subspecialize, then it's another 3 years, specifically in the case for reproductive endocrinologists and infertility specialists. And I mentioned when I was speaking initially that you have to do a research project as a part of that. So it's a pretty intensive 3 years that's divided up into 18 months of clinical work and then 18 months of research. So really diving deep into the reproductive hormones and different treatment options available, more advanced reproductive technologies like IVF or in vitro fertilization, and that sort of thing. And I think that's important to note, because it's yet another set of boards, both written and oral, that kind of gives you that double board certification. And so being mindful also when you're looking for a provider and looking for a, quote unquote, fertility specialist, what is their training? What are their credentials? Where did they do fellowship? Where did they do OBGYN training? Are they fellowship trained? These are important questions to ask and to get the answers to. And you have to kind of look at it with a discerning eye, which is really unfortunate, I feel like, in general, for people to not be able to tell exactly what level of training their specialist has. But for a truly double board certified reproductive endocrinologist and infertility specialist, it's publicly available information. You can look that up on the American Board of OBGYNs, or abog.org. And then you have other specialists, right? So beyond reproductive endocrinologists, so when I see a couple, I'm assessing both the male and female partners, and helping each of them. And if there is a male factor, which, as we mentioned, is a very common diagnosis, oftentimes that requires a referral to a urologist who specializes in male factor infertility. So again, that's additional specialized training, specifically in the treatment of male factor infertility. And depending on what the etiology is, that can involve additional laboratory evaluation, sometimes surgical intervention as well. And then you have maternal fetal medicine specialists, which often are confused with REIs, ironically, but they are also known, I've heard them called neonatologists and perinatologists. They're the high risk obstetric doctors. So oftentimes women of advanced maternal age are considered high risk. So a lot of our patients will follow with maternal fetal medicine as well, but they also do a 4-year OBGYN residency and then go on and do an additional 3 years, specifically in maternal fetal medicine. So they'll often do your advanced ultrasounds, follow you throughout pregnancy, and that sort of thing. And so I think it's important to understand those different buckets of providers, and where you are in your journey will be
Yes.
reflective of who you're seeing in that regard. And it's also important to know who is not these people, right? So thinking about other types of specialists, I would say beware of people who claim to be fertility experts, or fertility expert coach, or a hormone expert. You truly, I've seen 2-week training courses to become a fertility hormone expert. You cannot do that in 2 weeks. You cannot have an in-depth understanding of the intricate, reproductive endocrine system in 2 weeks. I wish you could, because that would have saved me 3 years of training, but unfortunately that's not the case. And so again, just being, aware of the different types of providers out there, being aware of who you follow on social media, where you're getting your information from, what are their credentials, and knowing that, in terms of medical doctors, you have MDs, which are medical doctors, allopathic trained, or DOs, which are doctors of osteopathy, and osteopathic trained. Both of those are, medical treatment doctors that could do additional treatments such as this, as opposed to some of the other ones that you might see out there. So I know that's a lot of information, but I hope that kind of helps break those up and give a little more, shed a little more light on each of those too.
That's great. No, thank you for digging in on that. And it was a great call out around training, for the average person. Again, I know when I was going through this, it was overwhelming to think about, which type of providers to see, who to go to, et cetera. And a lot of times it is, references from friends. Are there any kind of key elements of someone's background to look for? So you mentioned kind of where they go to school, where they got training, but I imagine the average person doesn't know what's a good institution or not. So is it looking for fellowship experience? What things would you call out, especially as you're looking at specialists in particular?
Yeah, everybody who, because I think there is a generation of reproductive endocrinologists and infertility specialists who were grandfathered in, so to speak, but that was like before 1970. So I'd say most of them are probably not in practice anymore, or are likely on the way out. But I think looking for both, they did OBGYN residency and fellowship train, and not necessarily where they did fellowship, but you also can see, there's kind of two types of board certification statuses. So you have board eligible, where someone has completed their initial training and they have not sat for their completed oral boards. And then you have board certified. And that's what you can see on ABOG. And it is not uncommon for people who are, like me last year, I'm 2.5 years out of fellowship. I'm board eligible because I hadn't had the opportunity to sit for my oral boards yet. But just seeing that they have those credentials is really the most important thing. And you can ask them, right? I always encourage patients, if they're a little weary and they're like, I can't tell, like, where did they go? Ask them and say, okay, well, if they're doing fertility treatment, well, then where did you do fellowship too? Because more and more you see a lot of different types of providers in fertility clinics. And it's really hard. Like, you think you're going to a fertility clinic, right? You should be seeing a REI, and that's not always the case. So I hope that helps answer that question a little bit too.
Absolutely. And I think most importantly to your comment, if you're not sure, ask. So I think that's a great clarification.